For years, I've been involved in research and practice regarding viral hepatitis, liver cancer, and liver transplantation. With the mission of expanding access to private funding, to implement the educational activity outside the borders of Europe, where EASL is actively engaged herself, and to boost the getting together of scientists and practitioners to create a strongest network to improve research programs and in the end also to improve educational programs as well. As a senior member of our community of hepatology here in Europe, it's a great honor, of course, but I also appreciate that it could be a challenging position because you have to test your capability in not only brainstorming, but also in teaming up with prestigious colleagues of yours and one above all, to strengthen the liaisons with other international societies that deal with the liver community. Well, we are actually at the very beginning of the story. So the next step would be to create the board of the foundation, which currently is composed only by a representative of EASL. We have to take on board non-doctors and other persons coming from advocacies, real world, to strengthen our capability. And the agenda now is packed with ideas, and we will probably start selecting a couple of them. One definitely in the area of research, that must be ambitious and must also fulfill the expectation of most. And the second program is to design an educational roadmap covering the unmet need in areas like Eastern Europe, Middle East, North Africa, and Latin America. I think that is more than enough to start with. Currently, the board does not already express his final opinion, so we predict we'll be starting with a research program involving basic science. This is a very ambitious program indeed, dealing possibly with regenerative medicine, which is a hot topic. Of course, we would love also to take care of unmet clinical need, particularly in areas outside Europe, but not to forget also the unmet clinical needs in Europe, which is pediatric hepatology, dealing with congenital liver diseases, because these need really a strong collaboration between science, practitioner, and advocacies. And in the end also, as I said, start a program of education in areas where hepatology currently is not the strongest discipline. And in fact, we are thinking about expanding our reach out to Latin America, Middle East, Northern Africa, outside the borders of Europe, actually. Well, first of all, we have been a long-standing competition with our American counterpart, EASL, with some relevant differences, in my opinion at least. EASL is a domestic society. EASL is an international. So EASL enjoys the flavor of a multicultural, multilinguistic approach. Think about France, Germany, UK, Spain, Italy, the countries from the Northern Europe, putting together their efforts to improve science, knowledge, and also practice. And in my personal opinion, we were very successful in creating clinical practice guidelines, which basically are recommendations to improve our practice, merging all the skills that are present in Europe, but one above all, cutting, the differences that really do exist between important countries like France, England, Germany, Italy, Spain. So our great success was to harmonize and standardize practice and attitude to develop science among countries that are so culturally and historically divided. There are several, but I believe that two are above all. In my personal opinion, the first validation in the field practice of generics to treat hepatitis C, with all the caveats and with all the issues that this brings along. I think that it could be a real breakthrough to expand patient access to a cure of hepatitis C. And the second important contribution here that might change strategies in medical care are the trials relating to therapy of hepatitis C in patients who have been kidney transplanted and subsequently or prior to kidney transplantation got infected with hepatitis C. In other words, this is a very important point because it will allow the utilization of hepatitis C infected kidneys to anticipate graft treatment. So in my opinion, this could be a real breakthrough. First of all, there have been a couple of symposia devoted to science and research that to a clinician like myself are really profitable. We do not have that many occasions, chances to get in touch with real science. I liked also the postgraduate course that was based on liver cancer. And of course, we are looking forward to hear the presentations to come this afternoon, tomorrow, and some of them are really appealing.